Hello, it's Monday, February 6, 2023. It's Dr. Rhonda Johnson. Today I'm talking about vitamin D and COVID-19. But first, my sincerest condolences to the people in Syria and Turkey and all the lives that were lost due to this massive earthquake there. Now, vitamin D is also known as a sunshine vitamin because exposure to sunlight helps our bodies produce this vitamin. Vitamin D is so important in calcium balance and bone health, and it plays a crucial role in the functioning of our immune system and in the inflammatory system. Now, during the COVID pandemic, there were a lot of conflicting data on the role of vitamin D in COVID-19 related health outcomes. But now we have a group of researchers out of Switzerland. They did a meta-analysis of a lot of literature, and they asked the question if vitamin D does improve health outcomes in patients admitted to the hospital with COVID. Now, this is published in the January 16th article of Pharmaceuticals 2023. Now, what did they find? They found that after reviewing all these papers, that vitamin D supplementation in patients hospitalized with COVID is protective. Look, vitamin D, if you're in the hospital, it'll help prevent ICU admission, and it helps folks not to die. And that was people in 18 and up. The authors also claim the protective effect is indisputable and can be considered as definitive evidence now. Now, one thing I thought was interesting from this paper that they noted that this protection from vitamin D is associated with the administration of daily doses of 400 to 1,000 international units for up to 12 months prior to COVID infection. So for most people, this would be the dose that they get in a multivitamin and mineral supplement, depending on their age. So the point is, you don't have to take mega doses of vitamin D for it to be protective in terms of COVID-19. Now, I want to make one thing perfectly clear. Taking vitamin D supplements does not prevent you from getting COVID. So why do I think it's important enough to be talking about it today? Well, because vitamin D deficiency is widespread in the global north and the northern hemisphere, especially in people of color with dark skin. Now, most experts recommend that you get your vitamin D level checked before you consider taking supplements. But I know a lot of folks don't have a regular source of care. They're not going to get a blood level test for vitamin D. And many people take over-the-counter multivitamin and mineral supplements, which is a good thing. And most contain the daily recommended allowance of vitamin D. Now, multivitamin and mineral supplements come in different strengths for infants, children, adults, and seniors. So make sure you're getting the right formulation for your age group. Now, who's most at risk for vitamin D deficiency? Well, I already said people with dark skin or skin that is rarely exposed to the sun, pregnant women, and elderly people with chronic conditions. Now, remember, you can get vitamin D from food sources such as fatty fish or fatty fish oils. You can also get it from orange juice and milk that's fortified, and some children's cereals are enriched with vitamin D. Now, of course, the sun is one of the best sources of this nutrient, but make sure you're wearing the sunscreen if you're at risk for skin cancer. Now, if you take vitamin D supplements, experts say take it with a fatty meal for the best absorption from the intestinal tract. Also, I have read reports that say take it in the morning and the afternoon, and avoid taking vitamin D before you go to bed because it can interfere with some of your other brain chemicals that regulate sleep. So we all know that sleep is important, and sleep also helps our immune function to be improved. So as I wrap up, vitamin D is good to help prevent COVID, bad outcomes in the hospital such as ICU admission and death. COVID, we know, is still around, and vitamin D supplements are not that expensive, and this is one more tool in the toolbox to survive COVID infection. So please, as always, talk to your healthcare provider about whether or not you need to supplement with vitamin D. And that's my message today. Take care and stay well, folks.